salivary glands. For the extrinsic, these are the major glands. Okay, we have the parotid gland, the submandibular gland, and the sublingual gland. Okay, for the intrinsic glands, we have the lingual, labial, and buccal glands. Right, so let's now go to the extrinsic salivary glands or your main glands. So the parotid gland is one of the three major salivary glands that produces and secretes saliva for the oral cavity. So it is bilateral. So you have one on the left and one on the right side of your cheeks. And usually the weight is about 14 to 28 grams. Okay, so the color of your parotid gland is yellowish when it is in fresh state. Okay, pag the gland is, of course, it has um, blood vessels or the blood supply. Okay, but if it is necrotic specimen, of course, it will no longer be yellowish in color. So it is composed of serous secreting units. Okay, so that will give you a clue of what the secretion is. So it is mostly serous in nature. So hopefully in your lecture, you will be talking about the different types of secretions by the salivary glands. Okay, so meron kasing mucus, there's serous. Okay, so again for parotid, it's serous secreting. Okay, so it has different boundaries as well as surfaces. Okay, so for the anterior surface, it lies against the posterior border of the ramus of the mandible. Okay, and for the posterior surface, okay, it lies on the external auditory meatus and the sternocleidomastoid muscle. Okay, so in this photo, okay, you will see this muscle, the buccinator, and under that will be the anterior surface. You will see the ramus of the mandible. Again, for the posterior, okay, sa likod, okay, you will see the ears on this region and the osseous structure nearest to it, as well as the muscular structure, is your external auditory meatus and sternocleidomastoid muscle. Okay, so the parotid gland has a pseudocapsule. Um, it is pseudo or false capsule because this fibrous tissue does not cover the entire parotid gland. Okay, so medyo false capsule siya. Okay, but it is composed of fibrous tissue and is continuous with the deep investing fascia of the neck. Okay, and the stylomandibular ligament is an anterior thickening of the capsule. Okay, so usually when we say capsule, just like in a cyst, so it's covering the entire structure. Okay, pero dito, different parts or different anatomical structures form the capsule. Okay, so again, it has the investing fascia of the neck as well as part of the stylomandibular ligament. Okay, and in this, on your screen, you will see the parotid gland here, the one pointed by the red arrow. Okay, so within the gland, you will see that the external carotid artery as well as the retromandibular vein passes through the gland. Okay, so the parotid gland is very important. Di lang siya basta-basta nagsisecrete ng serous fluid. Okay? Okay, so from the gland, so the parotid produces the secretion and it needs to travel somewhere, okay, so that the secretion will be expelled to the oral cavity, okay, so before it uh, before the saliva becomes present inside the oral cavity, it passes through the Stenson's duct. Okay? So this duct is approximately 5 centimeters long and it crosses the masseter muscle and then it turns inward, piercing the fat pad of the cheek, then to the buccinator muscle, and into the uh, mouth opposite to the maxillary second molar. Okay, so if you want to see the parotid papilla, where the parotid duct or the Stenson's duct uh, is exiting, okay, just refer to the second maxillary molar. Okay, so that is your Stenson's duct. And the um, prominence or the elevated tissue there, the one appearing as a round tissue is again your parotid papilla. Okay, so same with your incisive papilla, okay, kasi merong nagpa-pass through na major structure or nerve, okay, it forms an elevation. Okay, so that's the important parts of your parotid gland. For the submandibular gland, you will see it here. So I hope you can see the submandibular gland, the name. Okay, sa baba. Okay, so it has two, one on the left, one on the right. Okay, so it produces a mixed serous and mucus secretion. Again, for parotid, it's serous. Okay, for submandibular, it's a mixture of serous and mucus. Okay, and the location is found partly in the submandibular fossa below the mylohyoid muscle and partly on the floor of the mouth. Okay, so when you dissect the mandible, okay, this is your lateral cross-sectional view. Okay, so if the parotid gland has a Stenson's duct, the submandibular duct is the Wharton's duct. Okay, so it arises from the medial surface of the gland and is accompanied under the mylohyoid muscle. Okay, so it passes diagonally across the medial aspect of the sublingual gland and the duct adheres or uh, is in a close proximity to the sublingual gland. Okay, and it opens at the sublingual papilla that we usually call as the sublingual caruncle. Okay, so the caruncle is this one. Okay, so dun sa lower right side on your screen, you will see the opening of the Wharton's duct. Okay, the caruncle is the one in the middle. Okay, so if we will look at an actual clinical photo, so the duct is the one pointed by the arrow, and on the middle you see the lingual frenum. Okay, the caruncle is somewhere in that frenum, dun sa gitna. Okay? Okay, so we now go to the sublingual gland. So this is the smallest of the three major salivary extrinsic glands, and it rests on the mylohyoid muscles in the sublingual fossa. So if you recall your anatomy of the mandible, Okay, so you have the sublingual fossa close to the symphysis menti. So it is primarily a mucus secreting gland. Okay. So again, in here you will see your sublingual fold. Okay, so this fold indicates the position of your sublingual gland. Okay, and then your submandibular duct opening on the sublingual papilla is somewhere lateral to your uh, caruncle, which is within your frenum attachment. Okay. So if you have Stenson's duct for parotid, Wharton's for submandibular, we have these ducts for the sublingual gland. We have uh, a lot of sublingual ducts, which is what we call as Rivinis duct. Okay, so it opens separately at the floor of the mouth, and a greater sublingual duct, which is the Bartholin's duct. Okay, that opens on the sublingual caruncle together with the Wharton's duct. Okay, so they share the same opening. Okay, so the major glands, please take note, are bilaterally paired and have long ducts that convey saliva to the oral cavity. So please remember what are the different ducts, okay, corresponding to the glands, and what is the type of secretion, as well as some anatomical landmarks. Okay. So aside from the major salivary glands, we have the accessory glands. So these are your minor salivary glands. Okay, and it is scattered within the oral cavity. Some are in the labial area, some on the buccal mucosa. There are also on the pharyngeal area, the palate, and on the tongue. Okay, so on the palatal area, you will see these glands. Okay, so you have the retromolar glands, the palatine glands. Okay, so those areas uh, are also producing secretions. Okay, and you have glands on your lips. There are a lot of minor salivary glands in this region. That's why when you accidentally bite your lip, especially the lower lip, you will notice some enlargement of these glands, okay, as shown as an elevation, a rounded elevation on the labial region. Okay? And you have your accessory parotid gland on the cheeks. Okay, so the saliva functions, has important functions in the oral cavity. Okay, so we will not really talk about that on lab, but your saliva functions for lubrication so that the food will easily slide, because with the absence of good saliva, you will notice medyo painful for patients to eat because it produces a lot of friction. But if when there's lubricant on the oral cavity, the food can easily slide in the oral cavity. Okay, and the saliva also has some antibacterial properties, and depending on its acidity or pH, okay, it also makes uh, the oral flora in the oral cavity normal. Okay, so with less acidic, more neutral or alkaline pH in the oral cavity, okay, the bacteria that may produce dental caries or periodontitis, okay, cannot easily thrive or live. Okay, so that's how important saliva is. But with regards to anatomy, okay, you should know the different glands that produces this saliva. Okay, so some clinical relevance. Okay, so we have parotitis or mumps. So this is a viral inflammation of the parotid gland that when you look at the patient clinically, you will see it as a swelling, okay, or uh, on one side of the cheek, and it results to some pain on when every time the patient moves the jaw, okay, because uh, with inflamed parotid glands, okay, it lies on some um, muscles as well. So of course, you will expect some difficulty opening or closing the mouth. Okay. And also, if you will recall yung kanina, the photo, there are some, the parotid gland has some blood, blood supply or in the form of arteries, veins, and some nerves. Okay, it passes through the parotid gland, especially the facial nerve. Okay, so any inflammation in the parotid area, okay, may result also to pressure to the facial nerve. Okay, that the patient may complain uh, of some um, pamamanhid, okay, on the face or numbness. Okay, sorry, dumb. Okay, numbness in the face. Okay, kasi nape-press ang facial nerve. Okay, and also a blockage on the ducts or the where the saliva should pass through in a form of a stone, which we usually refer to as shallow leaks, okay, may produce some inflammation of the glands. Okay? So this is an example of a shallow lithiasis of the parotid gland. So this is a painful event, okay, wherein the duct is blocked. Okay, so we have to remove the stones that are blocking in the duct. Okay, and comparing shallow lithiasis versus chaladenaitis. Okay, so when we say chaladenaitis, it is a medical term for the inflammation of one or more of your salivary glands. Okay. And this is an example of a shallow lithiasis of your submandibular gland. Okay, most likely the Wharton's duct is affected. Okay. So those are the major and minor salivary glands found in your oral cavity or in the facial region. So kindly review them. Okay, so that actually ends the presentation for this afternoon. So we're done with Module 5 and Module 6. So expect another quiz next week, but for this week, we still have pending quiz for the past module. So as announced, you will be having the quiz hopefully tomorrow. So if in case na online pa din, please expect a quiz through Canvas. Okay? But I will announce if you have to log into the Google Meet.